how GLP-1 drugs will affect consumers' appetites. We have just done a survey on GLP-1 drugs and how that is going to impact food and drink consumption going forward. We did the survey with a test on over 2,000 people in Europe. And what is interesting on the survey, people will eat and drink less once they are off the drug. Over 50% food people said that, and it was over 40% for the drinks. Confectionery, snacks, soft drinks, baked goods really are the ones hit most. Fresh produce, water are the ones that people switch to. But possibly the most interesting factor that came through in my mind was that people ate out or got a lot less takeaways. Now that is high margin product for the food manufacturers and the drink manufacturers. So they will have to adjust their portfolios once more people become takers of this GLP-1 drug. At the moment it's very low penetration in Europe, so they have time to adapt. They've also shown in the past that that can happen. In the soft drinks industry, sugar taxes came in. Coca-Cola's, PepsiCo's of this world changed their portfolio to adapt to the new regulation, and lo and behold, they sold more expensive product to the consumer. So it's not all bad news as long as companies actually adapt their portfolios now whilst penetration is low. So that will mean coming up with innovation that basically looks at healthier products but also tries to keep convenience in there, which is one of the big driving trends for the whole industry for the last 20 years or more. If they can do that, then they'll probably be selling as smaller plate sizes, which was one of the other big statistics that came from the survey. People will eat less and drink less, but also it will make sure that they can keep their margins, maybe less volume, but keep their margins as high as possible. There is one caveat I'd say here. I'm not 100% sure that isn't just down to inflation, which has affected consumption trends across the board in both industries. So it is possible that a little bit of why people are not doing that and going to supermarkets is just cost. But I think we'll need to find that out over the next few years. But what is clear, food and drink companies will have to innovate carefully over the next couple of years as penetration of this drug increases, as it becomes easier to take. But also, we are seeing companies like Nestlé address that now and changing their innovation to have higher protein products on the shelf. Hopefully this survey answers the questions of